Hello, everyone. My name is Brian Sangalang. I'm a second-year medical student at the University of California, Riverside. And in collaboration with Dr. Nazarali and the CARE program from the Department of Plastic Surgery, very grateful to be able to talk about my project, trends in Instagram content amongst private practice plastic surgeons. So I'm sure everyone's aware of how expansive social media has become. And it's kind of evident in the way that a lot more plastic surgery residency programs are utilizing social media to either connect with applicants or to show off their program and talk about the achievements of their faculty and their residents and their students. It's become this whole thing. And a study was done amongst plastic surgery residency applicants that showed that a majority of them preferred to use social media as a way of getting to know different programs so they could find what was the right fit for them. And I thought that was an interesting fact. And I was curious if this was true for the private sector. And it turns out it is. So people who are interested in cosmetic procedures, the more they were exposed to it on social media, the more likely they were to undergo those types of procedures. Excuse me. And about 70% of plastic surgery patients believe that social media was an unbiased and reliable source for them to learn about the different procedures, their outcomes, their complications, and also to learn about the surgeons doing those procedures to really find the right fit for them. So because of how influential social media is, especially Instagram, I wanted to see if there is a difference in the content being posted by physicians with a low follower group, low follower account versus those with a high follower account, just to see what can be done. So in terms of methods, basically what we did was we went on Instagram and we identified 60 accounts that were of interest, and we stratified them into a low follower group count, which was less than 3,500 followers, and a high follower group count, which was 35 and more followers. We stratified the posts, the most recent 30 posts from each account, into these four categories: patient results, advertising, educational, and non-medical. And then we also looked for attributes of different posts. So whether they were displaying ethnic diversity, or whether they had intraoperative pictures, whether they had male presenting patients, their use of videos, use of hashtags, and whether or not they replied to comments. And essentially what we found was for the low follower group count, a majority of their posts fell under advertising, which is in contrast to the high follower group, where a majority of their posts came under patient results. And in terms of the other variables we looked at, essentially what we found was the high follower group count was posting way more patient results. They were posting less non-medical content. They were displaying more patients of color. They utilized videos way more, and they replied to comments way more. So in trying to come up with why this was, I really thought back to the academic sector and with residency programs. For me, as a plastic surgery hopeful, I preferred to use social media as a way of understanding more about programs because it felt like a more personable route. I was able to see how they acted on a day-to-day and not just when they're, putting on their best smile. And I believe the same is true for patients who are interested in undergoing plastic surgery. These surgeons with a high follower group count, they were talking to their patients more, and they had more people in their results that, looked more like a population, a diverse population that they're hoping to serve and attract. So I think it's really the sense of community that they're building along with their online presence that is really drawing people in. So further directions for this study, it'd be really cool if we could do a couple of focus groups to really analyze and hear from people their exact motivations and what their thoughts are specifically on different types of accounts and different kinds of posts. And the goal of that would be to create more distinct guidelines for maybe those with low followers to grow their online presence and entail grow their business. So with that, I thank you so much for your time. It was great to talk to everyone. And that is all. Thank you again.